Where Japan comes in is you have national health insurance, single payer, everybody's on it.
So, can you tell us kind of like the landscape of Japan in terms of CGT, as well as kind of, I guess tell the audience why Japan? Does it justify having to plan all this 10 to 12 months ahead and all that?
So I think, and actually CGT, the biggest advantage I think Japan has, specifically for CGT, when it comes to, in the end, what is it that we're getting out of this, right? So where Japan comes in is you have national health insurance, single payer, everybody's on it. And because the regulators, so this is the Central Medical Council under the MHLW, that helps define the reimbursement price in Japan. Because they have a say in that, once you get your price, even if your price is, somewhere between, maybe like 70% of what you could have gotten in the US if you were setting your own price, you have 100% of coverage. You're not having to worry about whether or not and spend the resources on negotiating with multiple payers, whether or not your product will be covered under Medicare or Medicaid. So you have a much easier access to market. And Japan has, these rules in place as well for people under insurance, where even if it's a very large, price tag on a product, especially if it's for pediatrics, there's a maximum amount a family will spend out of pocket on that. And it's incredibly low. It's very accessible. But he was, about to move to the US when COVID hit. But son was born, they stayed, he was diagnosed, and he's so thankful he's still in Japan because the out of pocket he's paying is pennies compared to what he would have been paying in the US. So I think, especially for CGT, because these are high priced products, even if the price is, lower than you would traditionally get in the US, it's not too significantly lower. But it's in my opinion, a much better exercise potentially for these types of products, because you're spending way less resources on those negotiations and you have the coverage. So even if your per product cost is going to be less, you're going to have far more sales moving forward. And I think the total revenue can have the potential to be much greater, at least, the short midterm, as you work out the kinks with the multiple payer system in the US.